Hi everybody. I have a few minutes, so I thought that I would take this time to go over some components related to subjective and objective data. Now, first of all, why is this information so important? We take all of these clues that the patient provides to us and we try to make some sense out of it all to provide a diagnosis and then treatment plan. And what you are ultimately going to be working towards as providers is the formulation of a SOAP note. And that's going to come down the road. But right now in this course, you're learning how to develop some important pieces, which is the S. The S stands for subjective. And in the subjective portion, we have some pieces that are included in that S. Remember, subjective is what the patient tells us. And it begins with the CC, or the chief complaint. And the chief complaint consists of 1 or 2 words that describes why the patient came to see you today. So it can be abdominal pain, or it can be sore throat, or it can be something else like that. That's the chief complaint. The chief complaint dictates the rest of the information that you will obtain in the subjective portion of your documentation. The next piece is your HPI, or the history of present illness. Now, the history of present illness expands on the chief complaint, and there is an old mnemonic that you can use that may guide you, and that's Old CARTS. Old CARTS stands for onset, location, duration, character, aggravating and relieving factors, radiation, timing, and severity. So using this Old CART mnemonic, let's do something simple for a sore throat. So we can say that the patient has a sore throat that began 2 days ago. And we know it's the throat. 2. Was it a rapid onset, or did it come on gradually? It was 2 days ago. It's sharp, or achy, or throbbing. Does anything make it worse? Does anything make it better? Worse in the morning. Better with Tylenol. And I always add the pain scale in here too. Pain, 8 out of 10. The timing. It's worse in the morning, it's better in the evening, it started 2 days ago, and then the severity, we've got your pain scale here. Now, in the beginning, you may want to consider all of these things when you're writing your note, and as you become more seasoned, you're going to know that I generally will write with my patient. Patient presents with sore throat that began 2 days ago. Recent contact with strep in the classroom. No other symptoms. Pain is relieved by Tylenol to a scale of 2 out of 10. without Tylenol, 8 out of 10. So I have a standard note that I write from years of practice. So the subjective now we know so far includes the CC and then the HPI. All right. Now there's more components. Whoop. I'll go back to my colored pen. My soap. So we have the CC and then the HPI. And then we're going to get history, past medical history. Does the patient have any chronic health conditions that they're treated for on a regular basis? And sometimes you need to guide the patient because they may not be forthright on all of the conditions that they have. I often will have patients say, no, I don't have any medical history. And then when I get to the medications, they're on levothyroxine or they're on depression meds. So past medical history is an important component. Past surgical history. Family history. Does anything run in your family health-wise? Then we're going to go to social history. Do you work full-time? Are you in school? What grade are you in? What does your diet consist of? Do you smoke cigarettes, alcohol, or drugs? Are your immunizations up to date? Now I want to know what medications they take. And I want to know what medications, even herbals, over-the-counters, vitamins, I need to know all of that stuff. And do you have any allergies to food or medicine? Or latex? So I want to know about all the allergies the patient has. Now, the last piece of the S is the review of systems. Now, the review of systems is going to again be dictated by the chief complaint. So we have all of these body systems, but we're only going to speak to the ones that have been commented on in the CC, and this is in patient's words. So the one thing we can do as healthcare providers, though, is we can kind of cheat a little bit. We can write in here all negative. Except for those noted in the HPI. So that saves us some time. It saves us from going through all of the body systems that have been mentioned in the HPI. So that's a little trick that we can do. And those are all the components in the S portion. Now let's go to the O. The O portion is the objective. The objective portion of our examination begins with vital signs. That's number 1, height, weight, temperature, blood pressure, respirations, oxygen saturation, and pulse. Then we are going to do the physical exam. Now, with the physical exam, we're going to examine body systems. But we aren't going to always examine every body system, because then we would be checking things that we don't need to check for. So we are going to check for body systems that are mentioned in our HPI. And that's something that we always have to do in documentation. And there are certain things that you're going to always document on. And I'm going to go over that right now with you. Certain things I'm always going to document on: the patient is awake or alert. Is the patient sleepy? If it's a child, are they crying? So the level of consciousness is something that I'm always going to document on all of my patients. And that's considered constitutional. So constitutional is something I always document on. Okay. Then we have head, eyes, ears, neck, throat. Those things are all going together. And then we have the lymphatic system, pulmonary, cardiovascular. We've got our abdomen. And musculoskeletal, GI, neuro, psychiatric, skin, and for women we've got our, we generally try to put our reproductive system in with the GI or the, that's typically where we do it. But now, let's see if our patient came in with that subjective finding of a sore throat. Are we necessarily going to document on their abdomen? No. And we're not going to check these things because it's not pertinent to the diagnosis. So the physical examination is dictated again by the HPI. Our patients, we're going to do the constitutional, heat, head, face, eyes, ears, nose, and throat, lymphatic system, and I always check lungs and heart on every patient, regardless of what they're there for. It's just part of my examination. But these are the components that we're going to document on. And that is the O. So that's where we're going to end today. I just wanted to make some clear definition on the S and the O and why they're so important to get right. These two pieces of information are how you're going to end up gathering all the clues that you need to come up with your differential diagnosis. Your differential diagnosis is the A. So this week I want you to work very diligently to ensure that you are doing this S and O appropriately. This week you're going to be working in groups, and I am going to assign group leaders. And we'll talk more about that in our weekly update that I'll put together later on today. But for right now, I thought this would be a good exercise for you to get a greater understanding of the S and the O. As we progress further along in the course, we're going to delve into the A and the P. But for right now, I want you to focus on the S and the O, so that this week when you're formulating these pieces in your case studies as a group, I want you to work together to come up with a really good subjective and objective assignment. All right? So I'll be writing your weekly update later on this afternoon if I have time. Clinic is kind of slow today. If not, I'll do it in the evening. So have a good day.